Did you know that many research studies have shown that chiropractic care can change brain function? Let's look at one of these studies. This one explored the brain's ability to sense the position of the elbow when the arm is moved. The study involved 25 people with low level of neck pain and 18 healthy people with no pain at all. The healthy group was the control group. All of the participants were tested for their brain's ability to determine the exact position of their elbow joint. They were shown how to position their arm while lying down and then were asked to reproduce this angle with their eyes closed. A fancy tool called an electrogoniometer was used to ensure that the findings were very accurate. The healthy control group was very good at knowing exactly where their elbow was positioned and could consistently reproduce the elbow position. But the group that suffered with low-level neck pain were not so good at knowing where their arms were. The group with low-level neck pain was then given chiropractic adjustments. After this, they were better at repositioning their arm. Their brains were better able to see where their arm was after they were adjusted by the chiropractor. This study was really cool because it shows that improving the function of your spine can not only help your brain see what's going on in your spine, but it can also help improve the way your brain sees what's going on in your arms. There are many, many more research studies like this that demonstrate all sorts of benefits from receiving chiropractic care, such as improved visual acuity and visual field size, reaction times, brain processing times, joint position sense in your ankle, spinal function, muscle strength in your legs, and prevention of muscle fatigue. We'll explore more of this research in future videos. In the meantime, make sure you get yourself checked by your chiropractor. Chiropractic care can be great for older adults. Research is showing us that it can really make a difference to your health, function, and quality of life as you age. With age comes wisdom, but age can also come with problems. Older adults may face memory loss, frailty, falls, arthritis, visceral and metabolic disorders, depression and anxiety, hearing and vision impairments, functional decline, and a host of other problems. But it doesn't have to be an inevitable downhill health spiral. There is such a thing as healthy aging. Your choices and actions can postpone or even reduce some of the undesirable effects of aging. The goal of healthy aging is to maintain physical and mental health, avoid diseases and disorders, and maintain active and independent. Healthy aging does require some effort on your part, but the results can be very rewarding and give you more control over your aging experience. Chiropractic care is an essential cornerstone of healthy aging. This is because chiropractors are in a unique position to help you maintain and even improve your overall function, health, and quality of life. Let's take a closer look at a couple of recent studies that indicate chiropractic care can have a protective role in preserving functional ability and self-rated health. Conducted at the University of Iowa and published in 2014, these two studies looked at older adults and their ability to carry out activities of daily living, such as eating, bathing, dressing, grooming, using the phone, handling finances, housekeeping, cooking, shopping, using transportation, walking across the room, and taking medication. As we age, it can become more difficult to carry out these sorts of tasks due to a decline in physical and cognitive function. Thousands of older adults with back conditions were followed up over several years. Those who had received chiropractic care were compared with those who were seeing medical doctors for their healthcare needs to see if these two groups were different. The researchers compared their general health status and their ability to carry out these activities of daily living. The researchers found that people who had received chiropractic care maintained their ability to carry out these activities. and had a higher self-rated health status compared to people who received medical care. The older adults who saw chiropractors maintained their ability to live independently, look after themselves, and preserve their health. Those who did not see chiropractors saw a notable decline in these areas. These studies suggest that older adults who receive chiropractic care are in a better position to maintain their ability to live independently and look after themselves. And they also feel healthier. So it's very likely that chiropractic care really can add life to our years. Choose chiropractic care for yourself and your family and reap the benefits of healthy living and healthy aging. As we age, our risk of having a fall increases. Every year, about 1/3 of older people have a fall. Falls are the leading cause of injury-related hospital admissions and deaths in older people, so they're a major problem. Did you know that many researchers think that chiropractic care can help you maintain balance and prevent you from falling over? Let's take a closer look at one study that was recently conducted in New Zealand that investigated whether chiropractic care could help brain function that is important to prevent falls. 60 Auckland-based older adults participated in this randomized control trial. Half were randomized into receiving 12 weeks of chiropractic care, and the other half were a control group who didn't get adjusted. One of the outcome measures they looked at was called the Choice Stepping Reaction Time. This was tested by getting participants to stand on a platform that had 4 panels that could light up. When a panel lit up, they'd have to stand on it as quickly as they could. If we take a look at this graph, the red line is the chiropractic group and the blue line is the control group. The higher the line, the longer it took the older people to take a fast step. What they found was that after 4 weeks, neither group had changed much in the speed at which they could take a step. But after 12 weeks, there was a dramatic, significant improvement in the chiropractic group. The improvement seen in this study was actually 2.5 times greater than a large clinical trial that looked at the effects of 6 months of exercise on the same stepping task. Being able to take a fast step is really important because researchers have shown that people who are quicker at taking a step are less likely to fall. It's important to note that for the changes to take place, it took more than 4 weeks of chiropractic care. This suggests that chiropractic care has a cumulative effect, and it can take time for some nervous system changes to take place when you or your family start under care. Another outcome measure the researchers in New Zealand looked at was called multisensory integration. This basically means how we process information from our different senses together to work out what's happening in and around us. The test they used in this study looked at how accurately the older adults combined sight and sound. Previous research has shown that older people in general struggle to accurately process sound and visual information together, and older people who have falls are particularly bad at doing this. Because it takes them longer to combine information from their different senses, it means they can't respond appropriately if they're faced with a potentially hazardous situation like a slip or a trip. What the researchers in New Zealand found was that after 4 weeks, the chiropractic group had become better able to accurately process sound and visual information. And they got even better at it after 12 weeks. This is pretty amazing because no one else has been able to improve this kind of multisensory processing before, and we know this is important in preventing falls. Another outcome measure the researchers looked at was joint position sense in the ankle. They found that people who received 12 weeks of chiropractic care became significantly better at knowing where their foot was, compared to those who did not get adjusted. This is really important because if your brain doesn't know what's going on in your ankle, you may not be able to accurately sense what's happening if you're slipping or tripping. This may make it harder to recover from a slip and stop yourself from falling. The interesting thing is that the chiropractors in this study didn't do anything to the participants' ankles. All they did was adjust subluxations in their spines. Restoring proper spinal movement seems to improve the way their brains and ankles communicated, improved their brain's ability to process sound and visual information, and enhanced their ability to take a compensatory step. And they even felt better physically too. Chiropractic care is an essential cornerstone of healthy aging. By restoring proper spinal function, your brain is better able to perceive what's going on in and around you. Make sure you see a chiropractor to help you maintain and even improve your overall function, health, and quality of life. When you are making the exciting preparations to meet your new baby, most parents are realistic about the fact that there'll be some tears along the way. Crying comes with the territory. But for some, the reality can be a lot more intense. 10 to 30% of all young babies suffer from infant colic, which is an unexplained condition that causes excessive crying in otherwise healthy babies. There is no known cause and few solutions. Being unable to soothe your inconsolable baby can obviously be quite distressing. Aside from being stressful, tiring, and even heartbreaking for parents, infantile colic can be a cost burden to our society in terms of healthcare resources. The good news is that there are some things that you can do to help soothe your baby. There are many studies that have shown that chiropractic care can significantly reduce periods of crying in colicky infants. Let's take a closer look at one of these studies. Conducted in the United Kingdom in 2007, the researchers wanted to find out how effective chiropractic care was for babies who were experiencing unexplained crying. 104 babies, 8 weeks old or younger, were able to participate in this study between October 2007 and November 2009 at a chiropractic teaching clinic. They were randomized into 3 groups. The first group of babies were given chiropractic care, and their parents were aware that this was happening. The second group also received chiropractic care, but their parents didn't know whether their baby was receiving care or the control intervention. And the third group didn't get checked by a chiropractic student. Instead, they received the control intervention, and their parents also didn't know whether their baby was receiving care or the control intervention. Over a 10-day period, the parents completed daily crying diaries, documenting their baby's behaviour. The first and second group of babies who were receiving chiropractic care were individually examined and given gentle spinal adjustments where required and as often as needed. If we take a look at this graph, this side is the average change in crying time, measured in hours, and down here we see the number of days, so up to 10 in all. We can see here that the babies who didn't receive chiropractic care still saw a reduction in crying time by about an hour less. But now look at the babies who did receive chiropractic care. They fared significantly better, with up to 3 hours less crying time in some cases. Researchers found that both groups of babies who received chiropractic care responded equally well. We can see here that the babies who did get chiropractic care are crying on average 2 hours less each day after 10 days of care. This is a significant reduction in crying, especially for the potentially frazzled parents. Interestingly, it didn't make a difference whether the parents knew that their baby was receiving chiropractic care or the control intervention. This confirms previous studies that have also shown babies with colic respond well to chiropractic care. It means that the child's improvement is probably due to the chiropractic care itself and not parental bias or the parent placebo effect. This study found that excessively crying babies were at least 5 times as likely to cry significantly less if they received chiropractic care compared to not receiving care. So it's very likely that chiropractic care really does help babies who are suffering from colic. The chiropractic care that was given to these babies in this particular study was also performed by chiropractic students under the supervision of fully qualified chiropractors, and their care had some remarkable results and made a real difference to the families involved. So imagine what a fully qualified and experienced chiropractor could do to help you and your family. Posture is often a forgotten aspect of our health, but it's actually really important. People who have bad posture usually end up with neck pain or headaches, and people with neck pain often have breathing problems. This can all impact your daily life and functional ability, and the problem does not end here, because the way that you breathe also has very important influences on posture and spinal stabilization. But bad posture also affects other health aspects. For example, a study conducted in the psychology department at the University of Auckland in New Zealand looked at the effects of upright posture compared to slouch posture on young, healthy people's resilience to cope with a stressful reading task. The study results clearly showed that when these people were held in an upright, good posture, they could cope with the stressful task much better than if they were held in a slouch position during the same task. In addition to this, the scientists found that good upright posture also resulted in the participants displaying a feeling of higher self-esteem, better mood, and lower fear compared to the slumped posture situation. Yes, you heard that correctly. Good upright posture is not only good for healthy breathing, but it can also make you more self-confident, feel better mood-wise, and reduce your feelings of fear, and help you be more resilient when dealing with a stressful situation. Forward head posture is particularly bad. You want your head resting nicely and directly on top of your spine. You don't want your head out in front of your spine. A normal-sized head weighs about 3 kilos, or 6.5 pounds. This is about as heavy as a bowling ball. Your spine is designed to hold that up without any problems at all. But if it's hanging forward, then there's a 3-kilo weight hanging off your muscles, ligaments, and connective tissues at the back of your neck. This is not a good thing for your spine and increases the burden, the strain, and the stress that your spine has to cope with. What is quite concerning is that the number of people who are showing up with forward head posture is increasing dramatically. It is becoming so common that it's been given a name, text neck, because many people believe we are seeing so many more young people developing neck pain due to the increased use of smart devices such as smartphones or tablets. Studies are showing that developing neck pain is not something that should be considered growing pains. It is not likely to go away by itself. We know that kids who develop spinal dysfunction to the point of them having spinal pain in teenage years, they go on to become adults with spinal pain problems. Teenagers with spinal dysfunction to the degree of having pain in multiple regions become adults with spinal pain problems in multiple regions, and so on. So the best thing for your children's sake is to nip it in the bud and fix the problem early so that it does not go on to become a lifelong problem for them. The health and function of your child's spine can significantly impact their future quality of life. A simple solution for little kids with smart devices is to make sure they lie on their stomach when they are using them. This makes it impossible for them to hang their heads forward. So keep a close eye on your children and teenagers' habits. Talk to them about the importance of good posture and a properly functioning spine for their health. And if you have any concerns, go and see your local family chiropractor.